Assalamualaikum and a very good morning to everyone. This is the first time ever we could gather all the prominent deans from the Faculty of Medicine from Research University in Malaysia, together with Monash University as a representative from the private medical school to discuss on the topic of post-COVID-19, addressing the new normal in conducting research. The speakers for today's webinar will be Professor Dr. Effendi Raja Ali, Dean of Faculty of Medicine, University Kebangsaan Malaysia, who is a Professor of Internal Medicine, specialized in gastroenterology and hepatology. Together with us, we also have Professor Datuk Dr. Adibah Kamaruzzaman, Dean of Faculty of Medicine, University of Malaya, who is a Professor of Internal Medicine, specialized in infectious disease. Professor Dr. Saiful Bahari Ismail, Dean of the School of Medical Sciences, University of Science Malaysia, who is also a Professor of Family Medicine. Professor Dr. Zamri Sakawi, who is currently the Dean of Faculty of Medicine, University of Putra Malaysia, who is also a Professor of Microbiology. Last and not least, we have Professor Dr. Muhammad Shahjahan Muhammad Yassin, the Head of School, Jeffrey Chia, School of Medicine and Health Sciences, Monash University of Malaysia, who is also a Professor of Family Medicine. So let me say a few words regarding the structure of the webinar. The webinar is structured into 4 themes. The first one will be on research focus. The second one related to the funding. The third one is on the conduct of research. Finally, we're going to discuss on the use of digital health technology. So each of the speakers will be given 4 minutes to discuss, and at the end of this discussion, we will take questions. Therefore, please submit your questions in the questions box. So the recent pandemic has affected the academic world, in particular our research, whereby all the non-COVID related research was discontinued abruptly. In a short period of time, the whole world is focusing on one single topic, which is COVID-19. In your setup, is there a shift in the research focus to COVID-19 related research? To start the ball rolling, I would like to invite Prof. Datuk Adibah to give your opinion.
Assalamualaikum, good afternoon everyone, and thank you to UKM for putting together this initiative and inviting us to speak at this very important and interesting webinar. So in terms of the shift of research focus, I wouldn't say that there has been a complete shift at our faculty. If you recall, PPUM was the only teaching hospital that actually was designated as a COVID-19 hospital during the height of the epidemic. We still have reserved wards and are operating with the ability to admit any COVID-19 patients if there are. We had one as recently as 2 weeks ago. So with that came the opportunity to do research at the height of the epidemic, and we continue to do research both in basic science, particularly looking at genomic structures. We have done quite a bit in public health research, especially the work that we were doing in terms of healthcare workers surveillance, patient research around patient care. Colleagues in radiology have done some nice work there. And we ourselves, my colleagues and I have got a randomized control trial looking at tocilizumab and methylprednisolone in patients with severe COVID. So by looking after patients and by being a COVID-19 hospital, it presented us with the opportunity to do research. But I wouldn't say that the focus of the faculty has completely shifted to COVID-19. The other departments' research continue as they are. Perhaps where there are elements where they can where there are overlaps, we obviously have included COVID-19. For example, Department of Psychological Medicine, up till now, much of their research has been in addiction as well as treatment of schizophrenia. They have taken the opportunity to look into mental health of healthcare workers in the COVID era. Colleagues in colleagues in primary care, again at the height of the epidemic, work with colleagues from computer science to develop apps to monitor patients with COVID. So where there are opportunities, where there are clear research questions that we could generate and we could do, we would do COVID-19 research. But the short answer is no, we haven't completely shifted to just doing COVID-19. Those who have research programs continue as they are.
All right. Thank you, Prof. Adiba. Can I get Prof. Saiful, to give your views on this topic?
Yeah. First of all, thank you so much, UKM, for the invitation. Thank you for the kind introduction by Prof. Norfilza just now. Yeah, I mean, I agree with what has been said by Prof. Adiba. It's not totally shift, but in the last couple of months, we can see there's a lot of research related to COVID-19, as mentioned also by Prof. Adiba. One of the things that we, apart from what has been mentioned, the lab research and also the epidemiological studies by some of our colleagues in here, we also looking at very much into the research in education. I think one of the things that is actually happened, rather than out of sudden, is actually a lot of things related to the new teaching method, for example, new assessment method, and that is the area that now many of our academic staff actually looking at and looking at the various issues, readiness of doing teaching, online teaching, for example, yeah. And also assessment, the issue, the security, and so on and so forth. So I think these are also the area that people are doing, apart from what has been mentioned. And also my colleagues, we also, I think, involved in a couple of studies related to mental health research as well. So that is actually, so additional to what has been mentioned just now. Thank you.
All right. Thank you, Prof. Saiful. We would like to hear the research focus for Monash University.
Assalamualaikum. Thank you for the invitation. I think it's basically the same thing. We have not, Monash University is a private university, it's completely dependent on student fees, which I will come back again and again throughout the session. But basically, we haven't changed our research focus. We have got a research focus in four areas: NCD, neuroscience, community medicine, and infectious disease. And of the infectious disease, we are primarily involved in dengue and Zika. We did make an attempt at getting involved in COVID, but we didn't want to sort of shift our focus in a big, significant manner. So we are primarily looking at collaborations, again, something that I will come back on a regular basis. So we're looking at collaboration. Someone wants to do COVID-related work, we are more than happy to work with them, especially if it also intersects with our current areas like NCDs and community medicine areas. We have as you may be aware, we have a big community set up in Segamat, which looks after which follows up a large number of individuals. So we have been developing collaborations with both local and private universities. UKM, UPM have been the main people we work with. With UKM especially, we work quite strongly with UMBI as well. With international university, we have been collaborating very strongly in the last year or two with UK and Australian universities, and have got some significant funding, but that has sort of dried up this year, really. So we are not changing our focus. It's very difficult to switch like that when you are on a sort of a relatively limited budget, and putting in resources completely changing is like turning a big ship, isn't it? It's not going to be easy to do. So we haven't really shifted in a significant way, but we are looking for collaborations in that sense. Thank you.
Right. Thank you, Prof. Shahjahan. I would like to invite Prof. Effendi to give your opinion on this issue.
Thank you. Good afternoon. Thank you, Prof. Nafizah, for organizing this event. And with my colleagues, the short answer is it's a minor shift. It's just another bloody virus that we are dealing with. So before I go any further, let me just comment that in the beginning of the COVID-19 pandemic, or still now, I think we have seen so much demand in the new norm of the teaching and learning rather than research activities. And typical KPIs for academician, whether in research university or in a private university, is about maybe 40% each for research, for teaching, and another 20% for services or community engagement. And with this disruption of COVID-19, I think in the future, we may consider to revise this percentage because it's clearly disrupted the research arena. And personally, I think the research and teaching will not grow or shift at the same rate during and after COVID. And we have to be realistic in this. And we have observed around the world, industries, pharmaceutical industry are racing each others to find a cure or vaccine and to combat these COVID-related issues. But again, the major bulk that has been going for years and decades is the non-COVID-related diseases. So for example, in Faculty of Medicine, UKM, we nearly have 400 academicians, and about 20% of them are at the beginning of their career research. And we really don't want to disturb or focus or change their research focus to something else because they have their own expertise, and majority are the non-COVID-19 research related. And yes, we do embark or to answer that small shift to the COVID-19 research, not a great scale, depends on the availability of resources, laboratory and expertise. We focus more on psychosocial, mental, and a bit basic science. And of course, with collaboration with many other faculties or institutes like human sciences or engineering, so and so. But of course, in our hospital, not as aggressive COVID-19 hospital like University of Malaya, but again, different cohort of COVID that we have in our hospital. And with this pandemic to continue, we witness a mortality maybe now around how many? Nearly 1 million, probably 900,000. And in Malaysia alone, 9,000 cases and plus 100 over mortality. That's something that we cannot ignore. Someone has really to focus to COVID-19 research too. But in our institution, not a major shift. Thank you.
Thank you, Prof. So we move on to the theme number 2, which is about funding. The coronavirus has ignited the scientific community in ways that no other outbreak has done it before. So what's your plan for the faculty internal funding for a quick win or a short-term research or even a long-term research related to COVID-19? So this time I would like to invite Prof. Zamri to give your comment on this issue.
Thank you, Prof. Nafizah. First of all, thank you very much to UKM for inviting UPM to participate in this webinar. Your question is on faculty internal funding. Actually, we don't have a faculty internal funding. We're not as rich as the other universities where the faculties, there's lots of money. We typically have internal funding from the university, which is distributed across all faculties and research institute, and so we have to bid for it. With regard to any specific funding for COVID-19, at the moment there isn't, but we can actually bid for it in terms of there is no specific things about COVID-19, but we can bid that project as part of the normal routine application process. To say whether there are takers from our researchers to conduct COVID-19 research, it seems that is based on individual basis, whereby if they are interested, particularly from our public health colleagues as well as from microbiology, only a few people are interested, basically because our hospital has just started and we don't have any COVID patients there, and therefore resources are actually limited, very limited, and therefore we still focus on our current strength, which is in NCDs, primary care, as well as infectious diseases, other infectious diseases apart from COVID-19. So basically that's it from UPM.
Thank you, Prof. Zamri. I would like Dato' Adiba to comment on this. Probably you have more money than the rest of the universities.
No, actually we don't. The funding from RU, from UM, what we've done is, what we do all the time, put out a call for proposal and really select the, research to be funded based on merit. We are kind of trying to strategize a little bit in terms of making sure that it's not just a research project, but it's a research program that's, sustainable and multidisciplinary. So that's more the strategy we're taking. If it happens to be a COVID-19 related research, well and good. So that's both for funding that's coming from UM or RU, as well as faculty internal funding. Most of our faculty internal funding comes from proceeds from UMSC, actually. We get some proceed from UMSC that we ring fence into small grants, seed grants for our junior researchers. And again, we don't make COVID-19 anything special that people get extra points. So really, whoever gets selected, it would be based on the quality of the research proposal.
All right. Thank you, Prof. Adiba. Can I invite Prof. Effendi to give comment on behalf of the Faculty of Medicine, University Kebangsaan Malaysia?
Thank you again. So our faculty has initiated a small amount of funding and approved about 16 to 17 both short and long-term projects related to COVID, cost us around 170,000. And of course, these huge application internally, not only from the Faculty of Medicine, but also from various faculty institute competing each others, again, using the merit and the panel to select those who can be give grant. And this is in collaboration with many faculties or institutes. And we also do support some, receive some internal funding from the main university. But I think the best thing is about inter-varsity collaborative work on this topic, because I can quote what our Vice Chancellor of University of Cambridge mentioning about the race for a vaccine is harming research collaboration on coronavirus. We cannot be selfish. We have to work with policymakers. We have to be together in fighting this virus. And I think I have never seen before that this pandemic shown that the scientific research being interrogated by the public or by politicians before it reaches the peer reviews, maybe before it reaches virologists or public health specialists. And this is never seen before. And how this, I think, influence the way that research or funding will be contributed to the researchers. So I think, to summarize, we got a small amount of money to use for the short and long term, but I think we just cannot shift it just like bang like that to the COVID. Many other important issues with regard to our country need to be considered.
Thank you, Prof. Effendi. Can I invite Prof. Saiful to share your views on this?
Yeah, thank you. Similarly, we do not have much money, but we do give seed funding for at least now 8 grants related to COVID-19 research. And as you know, some of the studies basically a simple study, though, for example, epidemiological data and development of the questionnaires and so on and so forth. So we give maybe about up to 5,000 per grant, just so that they can actually start the research, and then they can apply for bigger grant from others, including from university. And I think USM also actually given a couple of 100,000 for some of the research, and the good thing is that they expedited the process in order to get the grants, and we received, I think, a couple of thousand just recently. Yeah, thank you.
All right, so can I invite Prof. Shazahan to answer this issue? You can see that for the last few months, we noticed that quite a number of national and international grants open for COVID-19 related research, yeah? So in your opinion, do you want your Faculty of School of Medicine to concentrate on your current strength of your faculty, or is it better for you to divert or shift to the COVID-19 related research?
Yes, I mean, I think basically we, as I had mentioned earlier, we are not shifting in a significant way unless somebody comes in with money and expertise and wants to work with us. You know, somebody wants to do a study in Malaysia or in Segamat or in JB where we are based, and wants to work with us, and then they're bringing in the people, rather the expertise, as well as some funding, then we'll get into it. Otherwise, we don't want to actually develop a separate strength which is COVID related, because we don't know how long this is going to last. Whatever it is, it's going to, at some point, we are hoping it will end. And once it ends, we have to go back to our major areas of focus, you know, which is, you know, NCDs and old age, illness, dementia, all kinds of very big problems are there sitting at the back, and they have been pushed to the background because of this. So we just want to make sure that we focus and remain focused there. So it is, but as I said, it's external. We are very keen, you know. As far as if you want to switch, I think most of the speakers here have also mentioned it. If you want to switch to a new strength, you know, it requires not just significant long-term funding. I mean, no point giving a small little $1 or $2, $10,000, $5,000 grants to people, you know, students or staff or young researchers, because that is just going to disappear because they don't have the long-term mentorship and all that. So it needs a long-term funding. It needs the expertise of people who have those conditions, like people like perhaps Prof. Adiba, somebody who has infectious disease and expertise. There needs to be an enthusiasm and passion in those people who come in and take it on. And then, of course, at the end of the day, it requires time. You know, you don't develop a new focus and get it up and running in 6 months. You need years to develop a focus. You need a group of people to come in. You need PhD students to come in. You need lots of extra sources of different funding and different people to come in. So I think in those kind of, with those kind of things, we are not sure how long this is going to last. To switch like this is a thing. So we actually have, it's not that we have completely ignored it. You know, we have an infectious disease focus. There has been for quite some time we have been doing work on dengue, We have quite a bit of time, quite a bit of work being done with Cambridge and other places with Zika as well, you know. This was a few years ago. It's just that when we try to switch, or when we try to think about COVID, you know, we did approach IMR, for example, and see, can we do something together? But, you know, there are several issues with regards to private universities, you know. So private universities do not get first bite, either at funding or at this kind of big projects, unless we go overseas, you see. So I think at the moment, we are not switching. We're just sticking to where we are. The grants are primarily drafted and planned for our current programs, which are primarily NCDs and aging and those sort of issues, and brain research, which is another major impact. So we haven't really switched, and our grants are still in those areas. We have not applied anywhere internationally for a COVID-related grant.
Right. So I'm sure, Prof. Zamri, you realize that there are quite a number of the international grants up to like $1 million USD recently going out for healthcare-related research. You know, and it's all related with COVID-19. So what about UPM? Are you encourage people to apply for this kind of grant?
Definitely. These are actually a lot of opportunities for us to apply national and international grants. But unfortunately, a lot of limitations that we face, especially that, you know, you need to see cases as well. And the viruses, whereby, you know, the guardian is still Ministry of Health. You know that limitations in terms of universities working and collaborating with MOH. We did approach, and like Monash actually is not alone. We also face the same problem. A lot of hesitation about this, and therefore it's a bit difficult to find a collaborative partner internationally, to actually bid for the grant. In the end, we still work on whatever platform we have. For example, one of our colleagues actually has been working on diagnostics for infectious diseases. So she tried to divert a little bit and see whether her technique is really relevant for detecting the coronavirus. The other thing is that even at a national level also they have national grants, if I'm not mistaken, is by Ministry of Science and Technology. But that is mainly focused towards producing a prototype. And we did also have a few colleagues of us who participated, trying to, you know, the main idea is to produce IPs and so on. Even we have our colleague from Faculty of Computer Science who, you know, utilizing artificial intelligence, whether you can take selfies, whether not that selfies can be used to so-called screen COVID-19 patients. So this is very, very interesting. But to say, yes, there is a lot of grants available, but we are trying our best to acquire it at the moment.
Can I get Prof. Saiful, the other part of Malaysia? You should have some different experience, you know, to get people to apply for this international grant. Do you have anything to share with us?
Yes, of course. We have to encourage our staff, our lecturers, to actually apply for the international grants. And just a few days ago, I received that we received about 100,000 ringgit grant from One Health University Network. You know, and I'm sure we need to actually get more grants, international grants. So basically, so basically we have to try to bid and get the grants.
Anything, Prof. Effendi, you want to share about your experience in asking people to apply grant for national or international related with COVID?
Thank you, Prof. Nafisa. I think opportunity to grab either national or international grant, we must not ignore that. It's very important for the research group or individual who have a great personal track record in research. Again, it depends on the capability of the research group or researcher. It depends on resources that you have. I think we all know the strength, weakness, opportunity, threat we have in each faculty, and which particular individuals of research group that we actually should push them to go for this big gun of the international grant. So if I want to put the axis in terms of publications versus grant, those on the top right corner who has secured many grants in the past, who are very prolific researchers, who have published or output a lot. So perhaps these are the groups that I must identify to go about or to try for the international grant. And it is not solely focused on the virus itself, because the sequelae or the implication during COVID, for example, affecting NCDs, how the patient did not manage to go for review in the clinic, how's this diabetes poorly control and personal loss of job. And I think the implication, the complication of the COVID, NCDs, mental health, psychosocials, and I think that itself, without the grant, using knowledge, attitude, practice, can itself produce a lot of output for the individual or to the individual or the research group. So to summarize, yes, any international grant or national grant we should grab. Early motivation, early planning. We, for example, we know that regular FRGS, TRGS would be in February or January every year. So we must focus on the particular lecturers who are in the particular group, research interest, to come up with the early research proposal. Then by end of the year, we just fine tune and click by January, February for formal submission. I think we should encourage this spirit in the university. That's my comment. Thank you.
Thank you, Prof. Effendi. Anything from Prof. Dato' Adiba? You want to share your experience in asking people to apply for international grant in UM?
Yeah, so there is, I think we've taken the same approach as Prof. Shah at Monash. We haven't really kind of taken any big proactive approach because you know, the virologists in our medical microbiology and to a certain extent the parasitologists are capable of taking on COVID research. So I have really, Prof. CJ and I have really entrusted our colleagues that they know what to do whenever an international grant comes out, whether they're capable of doing it, whether they're interested in doing it. So I must say we've not been taking a very strategic approach to this. Likewise with, you know, public health as well as clinical. The limitation, and I think the elephant in the room is, you know, our inability to really work together with our colleagues in Ministry of Health to do something much more, you know, at a national level, which is quite sad in a way. Because we, you know, although we were the only hospital that were designated outside of KKM as a COVID-19 hospital, even at the height of the outbreak, we only in total saw 150 patients. So in terms of clinical research that's directly related to COVID, it's quite limited. But as you said, Prof. Effendi, there are many other, and Prof. Shaiful, you gave great examples of COVID-related research, whether it's in medical education or how the pandemic has affected other diseases. But in terms of rushing out to kind of apply for those international grants, we haven't done much apart from one with Oxford on vaccine trial. But yeah, so the answer is not really.
All right. Thank you, Prof. Dato' Adiba. So we move on to the conduct of research. The impact of the pandemic will be felt in the coming years. Yeah. So as you know that the global recession is taking place in most countries, including Malaysia. So eventually the budget for the COVID-related or non-COVID related will be affected. So how do you sustain the momentum of research in your university in a limited budget? Can I get Prof. Shah first to give comment on this?
Okay, rather difficult question, isn't it? I mean, you know, in the sense that the pandemic will have an impact on two aspects as far as research is concerned. The first thing is on finances. You know, being a private university, I think we are completely dependent on student income and student numbers, and when that gets reduced, we get into trouble. International students are another big source of students, and they are going to be significantly affected over the next couple of years. So it is especially affects private universities. But though I suspect public universities are also going to be affected because it's having an impact on government finances. But so what do we do when we have that, you see? I mean, what we have tried to do is try to continue the focus on our current areas. Second thing is that we try to build capacity while everybody is sitting at home, you know. We find that we have, it's a good time to build research capacity, to go and get grants, grant writing workshops and proposal writing workshops, statistics and analysis workshops and all these kind of things for young people. And this can be done exactly like how you are doing it here, Prof. Nafeeza, you know, so it can be done from somebody who is in overseas giving a session and giving feedback. So that is one thing that we have done. We also have found that though the student numbers have been affected a bit, but not as much as we initially suspected, you see. I don't know about other private universities, but it has had a slight impact, but not a lot. And as a result, we find that we actually have saved a bit of money. And this is because staff is not going overseas. They are not going for conferences. They're not going for this. They're not going for that and all these kind of things. And as a result, there's some money which has been sort of currently, which was budgeted for those sort of things, are not being used. So we have actually decided to take that money and put it as seed funding we actually have higher seed funding this year than other years because of this sort of slight savings we have had, you see. We have given about almost 250,000 as seed fundings to our staff, you know, small amount, 5,000-10,000 kind of things. And mainly those funding is primarily aimed at people who have got a project which can result in subsequent programs, which can result in another funding round internationally. You know, that means it's a pilot kind of a project, which will then help you to apply for overseas funding later on when things open up. So that's what we have been doing. Limited budget, but there are savings in some areas, and those areas we have sort of re-pushed it into the research thing. But we expect that those things are going to be very difficult over the coming years. So we have to build the capacity of young people coming in and taking on these projects and developing capacity and putting up more and more projects out there. We cannot 100% depend on the very senior, as Prof. Zambri said, about senior people who have got a very strong record of getting funding. I think some of them cannot continue to do that. They have to get young people to mentor them and make sure that they get into the game as well. Thank you.
Thank you, Prof. Shah Jahan. Can I get Prof. Zambri, because I know that your research is more on laboratory-related research that require quite substantial amount of money. So you want to comment on how you want to sustain the momentum of research especially the laboratory-based research?
Yeah, we were worried about this pandemic in terms of fundings and so on. But it seems now that it's not a problem because we have been getting grants now coming in, PRGS, and a lot of good news that our colleagues have been acquiring grants nationally, as well as industrial grants and international grants. So at the moment, we are still doing okay. Probably that will last us for another, depends on the grant, 1 year, 2 years, or 3 years. So it seems that in that sense, we may not be that affected. But of course, later on, we have yet to see the budget from at national level. Probably there's a reduction in budget. And we'll see whether the FRGS, which will be announced this month, we hope. I was also applying for it. So we hope that maybe we can get more grants. So if, let's say, there are enough fundings, maintained as maybe the same as previous years, there should not be any problem in maintaining the momentum. It's just that maybe to get international students to do the research will be a bit problem, though we actually get a lot of applications internationally for them to apply, but it seems that they cannot get into Malaysia at the moment. We hope that the borders will be open. And your question on whether my research basically is laboratory based and requires a lot of money, yes, definitely. So we need to strategize. We should not look at just national grants. We need to look for collaborators, especially international collaborators. So that is ongoing, and there are lots of strategies at department level. We have already informed them that we should not go nationally now. Everything should be international.
All right, thank you, Prof. Zamri. What about USM? Prof. Saiful, do you have any plan to maintain the research energy in your School of Medicine?
Right, thanks, Prof. Well, to be honest, I think there are a lot of positive things comes out from this pandemic, COVID-19. In terms of momentum, I don't think we actually we actually doing well. I mean, except for maybe the first 2 months during MCO, where we stopped most of the things. But otherwise, we continuing now. We are doing almost near normal sort of research project, and we can see that a lot of impact. For example, we have more publications now, including more than more papers coming for the COVID-19 related papers, and more publication as well, other publication as well. And this partly maybe because work from home, where people said that many more time, they have more time. In fact, I have one academic staff who said that she managed to prepare 20 manuscripts throughout in the last couple of months, which is actually a very good thing, just to translate in terms of what the impact of research. And so basically there's and as mentioned also, the budget, I don't think we have at the moment. We don't really feel we have a limited budget. I think we have a lot of grants. We still do have money to actually proceed with our research. But of course, to maintain, to sustain, we probably need to improve in terms of our collaboration, as mentioned, especially international collaborations, So we still need to do that, So the other things that I think also positive thing that came out from this is actually in terms of expedited process of research, research proposal, research grant, and then and the whole process as well. For example, our ethics committee now meet every other week, for example, and they approve expedited reviews, and now 100% online, so application and so on and so forth. So there are a lot of positive things that will help for us to actually sustain or even improve the momentum of our research. Thank you.
Thank you, Prof. Saiful. Can I get Prof. Effendi again to give comment on this issue? You know that these scientists and researchers, some of them are unprepared to start their research following post-pandemic. Yeah, there are quite a number of challenges that the researchers are facing, especially studies that are about to finish, like clinical trial and all that. So how do you tackle the disruption in, for instance, data collection, like because of the suspension of the enrollment, and then you've got a very limited space in the lab, so physical distancing has to be there, and clinical trial, recruitment of all the vulnerable subjects. So can I invite Prof. Effendi to comment on this?
Thank you, Prof. Nafriza. A very important and relevant question during this pandemic. I think what COVID-19 taught us is every sector is a health sector. Whether you're in the lab, whether you're in the community or hotel, supermarket, I think we have to practice all these SOPs to prevent further transmission, infection, and what we call this applying physical or social distancing, things like that. For clinical trial point of view, I think this is an abrupt, complete cessation from February, maybe until June or July. So a lot of clinical trialists has I so-called maybe hibernate during that period of time, and sudden cessation of the recruitment of the patient. And of course, these are the patient or the participant, the healthy individuals who are regularly coming to the clinical trial system for recruitment, for review, for sign the consent, so and so. So I think we have not witnessed this event before. And I think in the process of getting what are the best practice to be done, which is not really now, engaging with the sponsors, with the clinical trial sponsors, with the committee members who are involved with this, how we can do remote or distance style of practicing clinical trial using the telemedicine or telehealth, e-sign the signatures or e-consent, then e-assessment of the patient, and reporting into the, for example, in the electronic record form or database for the patient. However, we have to be very cautious in this because I think the Institutional Review Board of Ethical has maybe no guidelines how we modify this standard of clinical research in the arena of clinical trial, for example, and this could be a minor deviation of the protocol that we actually have to report to the sponsors. And I think we are still learning, and we have to really identify, we really have to use maybe in the future, not in the hospital ground anymore to avoid the congested hospital, maybe a mobile clinic for specifically for focused clinical trial to recruit the healthy controls or the patients who are on these various medication. And it is easy to say, and of course it costs a lot of money. But for some clinical trial involving intervention, for example, has to do assessment for endoscopy. Like it or not, at this moment of time, the patient has to really adhere to the schedule that's been given to them in order for the clinical trial to pursue. And those who are not, well, they are automatically deviated from the protocol, though they are so-called to now is a minor protocol deviation. But I think these are the issue that we have to come out maybe among the best practice guideline for clinical trial that we conducted in Malaysia, for example, or all over the world, and how we can collaborate actively, aggressively with Ministry of Higher Education, MOSTI, and in fact, Ministry of Finance as well, because it involves another extra budget. And we also have to address the financial assistance or more money from the sponsors or clinical trial organizers for us in order to carry on all the clinical trials, not only now, but also in the future when the COVID-19 is finished.
Thank you, Prof. Effendi. Can I invite Prof. Saiful? I know the nature of your work is mainly, majority of it is field work. Do you facing the same difficulties in conducting your research post-pandemic?
As I mentioned just now, except for the first 2 months of our MCO, I think the rest we are doing actually fine now. We are continuing our field work, but of course we also develop guidelines. You know, we have guidelines for those who are going to the community. In fact, those who are doing clinical trials as well. You know, and those who are going to the field. So we develop guidelines so that they have to adhere to the guidelines. Otherwise, basically now we are almost, I would say that full-blown continuing our clinical, our studies, our research. Yes.
What about Prof. Zamri? How are you going to ensure that all your researchers are working in a safe environment?
Of course, we have our we have our SOPs, especially in the lab, that you know, we have to maintain physical distancing and very strict and hygiene, things like that. So these are being led out by the university, and also we have officer to actually monitor these activities. So Alhamdulillah, at the moment we don't have any problem complying to the SOPs. So that's it.
All right, thank you, Prof. The final theme is on the digital health technology. I think this is a very important topic. So in dealing with the pandemic and the reality of physical distancing, it's actually forced people to use the digital tools, to stay connected and to stay productive. So clinical trial, for instance, is affected as we have to minimize the face-to-face session with the vulnerable population. So in your opinion, to what extent we should focus on this technology in order to do what is called as an action at distance? Can I get Prof. Shah to comment on this?
Okay. Yes, I think, you know, late last year, we actually decided that we want to go into digital health and digital technology in a sort of a big way. It is one of those sort of areas which can naturally falls under multi faculties. You know, it's medicine, School of IT, School of Engineering, and all these people naturally will come together or should come together. You know, you can't run it in one single department or one single faculty. So we did decide, and we actually put in a fairly substantial sort of plans for this year to do that. And of course, anyway, everything was very nicely done. We had planned everything very well. And then next thing you know, everything locked up. Now we got locked up already, you know, so everything has been delayed, unfortunately. But the fact is that digital health, because it had started, we have actually a strong push towards it. We have got something like about 20 projects, which are significant projects, which have been already started, not started, which have been proposed, and grants have been written, but we haven't got any funds yet. We haven't put anything out yet. So the areas we are looking at is very much things like apps, but not, when we initially started, it was nothing to do with COVID, of course. You know, it was, you know, digital apps to assess people's gait for Parkinsonisms, or, you know, frailty for people who are sort of, you know, prone to falls, or dementia, assessing dementia as progress using digital technology, phones and all that. And so we have developed or started developing apps which will allow that. I mean, you know, these days it's not that difficult to do. Of course, the problem of course, is you can develop the apps, but to test it and then to see whether it actually makes a difference in the patient's life, in assessing progression of dementia, for example, or something requires you to go out there in the community and actually test it. You know, while there has been proposals, and while we'll be happy to collaborate with anybody else who may be interested, we haven't gone there yet. But I think there has been a strong push towards digital technology. There's also been a strong push towards digital technology in education as well, you know, so in the sense that We now have apps which actually looks at the time, which gives students an individualized timetable to the student, individual student, so that they know where to go, where it's happening, and any changes. And also the learning outcomes are there, the slides are there, the things are there, everything is in the timetable, everything goes in, and any changes in the timetable automatically gets updated as well. And attendance is also taken at the same time. So those are the, with education, we have started doing that, and that seems to be working, because that had started before the COVID. But since the COVID, we haven't been able to test any of these things which we have sort of started developing, you see, and see whether it actually works. And especially in relation to clinical trials, which is where ultimately you need to test whether it's going to have an impact on the outcome of anything, because digital technologies are very good at assessing at a single point in time, but perhaps accurately, but how valid, how reliable it is, and then 6 months later, if there is a change, is the change significant? Those kind of things hasn't yet been done, but we are very keen on getting involved in that.
Oh, great to know that Monash are already embarked into digital health. What about Prof. Dato' Adiba, you want to comment on involvement in digital health technology?
Yeah, so like Monash, we kind of got together a group of clinicians as well as colleagues from computer science, and we had 1 or 2 colleagues from law as well, and formed what's known as the eHealth group that started more than a year ago now. So this was actually fortunate because when COVID came, the team quickly sat together, and that's how we came up with Cosmos. Within, I think, 3 weeks, they came up with the app for patient monitoring. So yes, to say that we are going into digital health in a big way would be correct. From looking at how we could align the EMRs to patient registry, so that we can data mine for not just for research, but also for quality improvement purposes. So that is currently being worked on, to have cancer registries. We actually developed a COVID registry that was linked to the EMR as well, using RateCap. So from a EMR patient management point of view, we're working very hard together with the hospital to kind of make it easier for researchers to access patient data. Of course, there are issues around PDPA and all that's currently being sorted. So there's a concerted effort towards that. The other is, of course, telemedicine. We're just taking baby steps with telemedicine, again, because of the concerns around confidentiality, PDPA, etc., etc. The other area, and I think, again, Shaiful and others touched on, is in terms of student learning. So we view digital health not just for patient care, but in all of the 3 missions that we all have to undertake: service delivery, health service delivery, education, as well as research. So we're trying to align all those 3 as much as possible within this eHealth group, which hopefully one day we want to create a digital health unit within the faculty and the hospital. So yes, we're putting a lot of thoughts and hoping to get funding for this. Not that we've been very successful in really pushing digital health at the faculty.
Thank you, Prof. Adiba. Can I get Prof. Saiful to comment on this? What about in USM? Are you going to incorporate digital technology into research, for instance, family care?
Well, not so specific. Basically, we do not have a specific plan at the moment. Of course, development of apps, converting from the questionnaire into apps and so on. So, I mean, that is ongoing, but nothing specific. But we are actually now, as Prof. Adiba said, that we are also empowering on or enhancing our teaching and learning methods and also especially assessment, looking at the security and so on and so forth. So that is basically the technology in general. Yeah. So nothing big from USM probably, Prof.
All right, thank you.
Prof. Fiza, can I just interrupt there for 2 seconds, just because I've got all the deans here. This is more to do with, since Prof. Saiful mentioned assessment, Prof. April from surgery has developed this basic surgical training program, and the assessment is all online, and working with Academy of Medicine to develop this program. So taking on from that, we are developing a much more, hopefully, comprehensive and sophisticated program using Microsoft Teams for all the assessments that's going to be required in the master's program / national curriculum. At the moment, we're just mapping it out. So hopefully this will be shared with all the universities, and you all will naturally be invited to be part of it. But right now we are just doing the mapping and working with people from Microsoft, because that's why I asked the deans the other day if you all have access to Microsoft 365. And the aim is that all our masters trainees will have e-portfolios, and the assessment and all that will be on a Microsoft platform. This is obviously going to take a while, but please, bear with us for the moment whilst we do this. Yeah, not doing it as research, but doing it as part of the masters, Penambahbaikan Masters program.
All right, thank you, Prof. Adiba. Lastly, I think Prof. Effendi, do you want to comment on the use of digital health technology?
Thank you, Prof. Fiza. I think digital health technology is the way forward for many institutions, not only focusing on the research aspect, education, assessment, so and so. And we do not have an electronic medical record yet in our hospital, but the total hospital information system is in progress. I think by early next year should be start doing that, and there will be a pilot program, 2 departments for the telemedicine, Department of Medicine and Psychiatry in the hospital soon to test for the telemedicine. But I think digital health is, nowadays we are still learning, but I think for the futures, maybe 30, 40, 50 years, it become a normal physiological process. For example, in the arena of clinical trials, that, as you mentioned earlier on, at distance, or clinical research at distance, is a new norm of conducting research, clinical research trial. For example, of course, this to minimize the face-to-face contact, avoiding healthy control of patients in the congested hospital, or even to prevent them using public transportation. And I think we as researchers must be proactive, persistent, adaptable, and also assist our patient for clinical trial to run very smoothly. And of course, engagement with the sponsors using various platforms so that clinical trial can be run very smoothly, for e-assessment, e-sign, e-consent, many e-things, so that can become a norm for the future. And I think it remains to be seen with the Institutional Review Board of Ethical to handle this new norm at the practice. And I think it's the best time to have this forum so that we can share the ideas, approaches, so that we can come out with the best practice or some kind of solution. Let's say 50 years time, COVID 2080 coming. So we have a ready-made mechanism already how to do that. And I think one thing that I learned involving in clinical trial for the last couple of months, social distancing, but this is maybe a social isolation or social suppression with the subject we also need to consider. Because I think the antidote for the social distancing is really human connection. We really have to do as teleconference or telemedicine, enrolling or using our support nurse or clinical nurse, a clinical support system to get in touch with the patients, with vulnerables, like say elderly patients or people who get chronic diseases who cannot afford or cannot come to the hospital for this COVID-19. So I think this action at distance, as you mentioned, will become a norm. I will not call a new norm, maybe the next norm or another next norm for the future. So I think we have to get ready, we have to be proactive, and we will ready to be changed. If not, we all be changed. And I think let us change the crisis of the COVID to the opportunity, change this crisis to opportunity that we can do plenty things together with many other institutions, either public or private, for the betterment of our country. That's my last comment. Thank you.
Thank you, Prof. Effendi. I think that's the end of the forum. I would like to congratulate and thank you for everybody to joining me for your views and comments on the issues related to research. And I agree with Prof. Effendi that we should come together to address the challenges facing due to any kind of pandemic. So I think if the Kementerian Pengajian Tinggi, if they could hear your views or your challenges in facing all the issues that we have been discussed just now, we have to admit that there are no single national guideline to for the biomedical researchers to even adjust or adapt or even adopt in performing either clinical trial, community-based or laboratory-based research in a safe environment. And with that, I thank you.
Thank you very much.
Thank you so much.
Thank you.
Thank you.
Thank you, everyone. Bye.
Thank
Bye-bye.
you. Thank you so much.
Bye.
Assalamualaikum.
Like Islam.